aspect, and I'm looking for help for our great seniors, especially in particular, and that's what we're doing today. You'll hear something which will be very shocking. So we're doing things that nobody thought could be done, and it's going to have an incredible impact. Unfortunately, we've been waiting for Congress to take action for many decades to reduce drug prices for more than just a small handful of people. But even the small handful of people never got price reductions, and I'm unwilling to wait any longer. Therefore, today I'm signing 4 sweeping executive orders that will lead to massive reduction in drug costs. Massive. We've already gotten them down a little bit, but that's not good enough. First time in 51 years, as I said, but that's not good enough. They represent the most far-reaching prescription drug reforms ever issued by a president, nothing even close. Joining us for this important occasion, our Secretary of Health and Human Services, Alex. Where is Alex? Alex, thank you. Alex Azar, CMS Administrator, both doing a great job. Seema Verma. Seema, thank you, Seema. FDA Administrator, Dr. Stephen Hahn. Stephen, who's really speeding up the process of therapeutics and vaccines. And I just heard from some of the big drug companies, and they're saying FDA has really been moving the process along. It's very important, Stephen. Can you move it faster, please? Okay. Thank you. Great job. We appreciate it. And Administrator of Health Resources and Service Administration, Tom Engels. Tom, thank you. Thank you very much, Tom, for being here. We're also pleased to have with us our great governor from the state of Florida. Incredible state, incredible guy. Governor Ron DeSantis. Thank you, Ron, very much. Appreciate it. And you're going to say a few words in the end. Good. Representative Matt Gaetz, our friend. Hi, Matt. You're so quiet back there today. I've never seen you like that. Thank you, Matt. Great job you're doing. Appreciate it very much. Speaker of the Florida House of Representatives, Jose Oliva. Jose, thank you, Jose. Very much. Good job. And many other state and local leaders. We have a lot of them. Thank you very much for being here. The 4 orders I'm signing today will completely restructure the prescription drug market in terms of pricing and everything else to make these medications affordable and accessible for all Americans. The first order will require federal community health centers to pass the giant discounts they receive from drug companies on insulin and EpiPens directly to their patients. You know, insulin became so expensive, people weren't able to use it. They desperately needed it. We have it to a level that you're not going to believe. EpiPens, likewise. You've been reading horrible stories about EpiPens over the last 6, 7 years. Horrible, horrible, horrible increases where they went from almost nothing to massive amounts of money. We're changing that right now. These providers should not be receiving discounts for themselves while charging their poorest patients massive full prices. Under this order, the price of insulin for affected patients will come down to just pennies a day from numbers that you weren't even able to think about. It's a massive cost savings. The second executive order I'm signing this afternoon will allow states, wholesalers, and pharmacies to do something other politicians have promised for decades and decades, but never done. They never delivered. We will finally allow the safe and legal importation of prescription drugs from Canada and other countries where the price for the identical drug is incredibly lower. It's a difference like you wouldn't believe. 70%, 80%, 90%, 30%, but massively lower than the identical drug made in the same plant, the same factory, the same exact drug, same everything, same box, same pill, and yet it's 50, 60, 70% lower. And this is something that Ron and I have been discussing from the time Ron got elected, and I've been wanting to do it, and it takes a long time from a legal standpoint. and we've got it all worked out. So you're going to be getting massive drug savings in Florida and other states. And we've had numerous states that wanted to do it. Ron really was at the forefront, I will say that. But you have other states that have caught on. It's caught on very quickly. Didn't take them long to figure that one out, Ron. It's too obvious. We pay for all of the research and all of the development, and foreign countries pay absolutely nothing, and our consumer gets charged. This has been going on for decades. The American people pay an average of over 3 times more for medicine than the Canadians. Many people go to Canada. I see it all the time. They go to Canada to buy drugs, and then they come back, prescription drugs, because they save so much money. The trip is well worth it. The Obama-Biden administration pledged to end this unfairness and allow drug importation, but they never got it done. They were unable to get it done. They didn't get a lot of things done. But under my administration, we're standing up to the lobbyists and special interests and fighting back against a rigged system. Rigged system, you've heard that word before. I'm unrigging the system that is many decades old. We're doing something that should have been done a long time ago. The third revolutionary order I'm signing today will prevent middle men and women, I guess. But you've heard about the middleman, right? The middleman that makes so much money nobody knows who they are. Nobody has any idea who they are. They make more money, perhaps, than even the drug companies themselves. And the drug companies, in all fairness to them, Big Pharma. And they're doing a great job in the vaccines. They're doing a great job in therapeutics, I can tell you, because I deal with them a lot. But I think the middlemen make more money than they do, and they don't do much. Maybe they don't do anything. Some people say they don't do anything. Nobody even knows who they are. But the middlemen are making a fortune, and pharmacy benefit managers and people are just bilking Medicare patients with these high drug prices while they pocket gigantic discounts, gigantic discounts. The amount of money they've made over the decades is too incredible even to speculate or say. It's massive. Some very rich people are not going to like me very much today, I can tell you. I probably know them very well. I probably see them in Palm Beach. But nobody ever talks about who they are. Everyone, I hear the middlemen for years, the middlemen. Right, Alex? And he doesn't know who they are either, but he knows they're rich. They're not going to be so rich anymore because the money is going down to reduce the price of drugs, prescription drugs. So that's a big thing. That's a tremendous step. It should have been taken a long time ago, but they have a great deal of power. And I don't have to tell you how many phone calls I've had in the last few days when they heard I was going to be doing this. I've heard from people that I haven't spoken to in a long time. Frequently, drug companies give these middlemen discounts of up to 50% on the price of prescription drugs. But too often, those discounts are not passed on to the pharmacy counter, meaning the people. This rule will pass those billions and billions of dollars a year, I mean, many, many billions a year in discounts onto patients, directly onto patients, saving Americans with high drug costs thousands of dollars a year. Individual people will make thousands of dollars a year. You're not going to believe the impact that the things we're talking about today are going to have. Mark Meadows, our chief, our great chief, is sitting here, and he's just can't even believe it because he was a very successful congressman. He's been after people to do this for a long time, and they never got to the gate. I understand why. Tremendous pressure. Tremendous pressure put on the president not to do it. The fourth and final order I'm signing today, this is the granddaddy of them all, will end global freeloading on the backs of American patients and American seniors. For decades, our citizens have paid the highest prices for drugs, prescription drugs, anywhere in the world, and it's not even close. Foreign nations have paid vastly less for the exact same drug, again, in the exact same box, from the exact same plant, from the exact same company. They would pay 10%, 20%, 30% what our people are paying. A pill that would sell for $1 in certain countries. I won't name them. They're all allies, right? They call them allies. I call them so-called allies. But a pill that would cost $1 could be $7, $8 in our country. Same exact pill. We pay 80% more than nations like Germany, Canada, and others for some of the most expensive medicines, identical in all respects. This means that Americans are funding the enormous cost of drug research and development for the entire planet. We are bearing the entire cost of all of this. They're bearing none. They say this is what we're going to pay. In some cases, it's a socialist country. So we're paying to reduce drug prices in a socialist country. How does that work? How does that work? And these are things that should have been done a long time ago. And even from our standpoint, we would have done it more quickly, but we have to go through vast amounts of waiting periods, waiting times, and this is an incredible day. This is just a big day. This is a big day. I've been waiting for this day for a long time. We incredibly and foolishly bear the full cost of all research and development, which is massive. In all fairness to the drug companies, it can take 15 years to get something approved, billions and billions of dollars for a simple drug. It also means that the U.S. taxpayers are effectively subsidizing the socialist healthcare systems of foreign welfare states and many other countries. We will end that abuse and restore the principles of free enterprise, but this doesn't even have to do with free enterprise. This has to do with common sense and courage, to be honest, and courage. Under this transformative order, Medicare will be required to purchase drugs at the same price as other countries pay. So we would pay 4 or 5 times more for a drug. We now pay, if somebody else pays $1 and we pay $5, we're paying $1. Now, what's going to happen is their number will go up, our number will come very substantially down, and we'll all agree at 2.5 or 2 or whatever the final number is. But if some country is paying wherever it may be in the world because they had a better negotiator, because they had smarter people than we have, and that's what it's all about. Maybe more honest people, who knows? Could be a lot of things going. But we get now the lowest price anywhere in the world, and no more will we have to suffer by saying, gee, why is it so much cheaper for the exact same drug in some other country? We will determine what other medically advanced nations pay for the most expensive drugs. And instead of paying the highest price, Medicare will pay the lowest price, and so will lots of other U.S. buyers. Medicare is the largest purchaser of drugs anywhere in the world by far. Medicare, largest purchaser of drugs in the world. And we're finally going to use that incredible power to achieve a fairer and lower price for everyone. Everyone will get a fairer and much lower price. This is not talking about 0.5%. This is big stuff. Under our ridiculous system, which has been broken for decades, we aren't even allowed to negotiate the price of drugs. Can you believe it? I said, when are we going to negotiate? We're not allowed. We're restricted by Congress from negotiating the price of drugs. Can you imagine? You say, I want to get a better price. I'm sorry, sir, you're not allowed to do that. That's illegal.